Hello, I am the program director for the Bridge, and I'll be listening to your guys' proposals today.
Hello, we are a group of St. Louis University students who are studying to become healthcare professionals. We have found the Bridge program through one of our classes, and we have noticed that you guys are a program that helps the homeless and at-risk population within the St. Louis area to help find them stable housing. And today we've come up with a possible intervention to help improve your program.
So we found some different possible needs that could be addressed to help improve the program. Some things that some of the other students at St. Louis University found were maybe some vision assessment needs, help with prescriptions, obtaining prescriptions, dental services, transportation issues, trying to get the people to the different facilities that they need to be at for these services, and then nutrition counseling and management for diabetes is kind of what we're going to focus on. We found a comprehensive intervention for helping especially homeless people with diabetes management, and so we are going to apply that. That's from the National Healthcare for the Homeless Council.
So how did you guys come up with this intervention?
We chose the health belief model for our intervention because this theory considers how likely a person believes he or she is to develop a disease and take action to prevent or treat it. The first concept, perceived susceptibility, looks at if a person believes a certain health issue can actually affect them. In this case, we consider questions such as, do they have a family history of diabetes or obesity? What are their eating habits? Do they use alcohol or drugs? What are their exercise patterns like? If the client already has diabetes, we must look at his or her perception of the severity of the illness and its effects on daily life. Complications of diabetes include sores on the lower extremities, infection, amputation, ketoacidosis, and renal failure, resulting in expensive hospital care. Knowledge of these factors may affect the desire to manage diabetes effectively.
The third concept of perceived benefits leads us to ask the client if he or she thinks making healthy lifestyle choices related to blood glucose control would be beneficial. Do they value avoiding complications of diabetes? How do they view a healthy life and wish to achieve it? Perceived barriers are vital because these prevent the client from leading a healthy lifestyle. What barriers do the client think prevent healthy blood sugar maintenance? Is health literacy high enough to understand literature on diabetes? Is the patient able to get medication and receive continuous health care? If not, what is preventing that? Finally, what cues to action are there to encourage change? Do our interventions provide useful information for sustainable change? Last but not least, we assess self-efficacy. Does the client believe he or she can make and sustain a change? This concept leads to permanent health promotion.
During our intervention, we hope to accomplish our mission statement by providing information, demonstration, and necessary supplies and resources. We aim to reduce the severity of diabetes and promote health while addressing additional barriers of the homeless in an achievable manner for the individual. Through this, we want to promote self-management and foster a community in which diabetes can support one another and improve the population's wellness at an affordable rate.
We also identified some issues related to diabetes management for homeless people, such as access to healthy food, money, education, health supplies, additional resources, and a source of normal health care.
Step one of our intervention would be an interview. This interview would help assess health habits and monitor them over time with diabetics. The interview would be conducted by a healthcare professional so that health literacy would not be an issue. The health professional would help the diabetics fully understand the questions they're being asked so that we get a more accurate assessment of what is going on in their lives. Additionally, it would be advised that pre-diabetics also partake in this. The interview would consist of questions regarding health habits and living conditions.
Are there any specific aspects you guys would be touching upon?
Some of the health habits we would assess are drinking, smoking, and drug use, as well as exercise patterns.
Also, any prescriptions and the dosages and any other medical equipment they would be using. Also, a 24-hour diet recall for nutritional information.
We'd also look at other physical and mental health issues. We would take a vital sign baseline so that we would know what their health is. We would look at their feet and legs for ulcers and sores related to diabetes. We would take an initial blood sugar check so we know what a baseline is for their blood sugar as well. And we would also look at other symptoms of diabetes that they might have and possibly take a urinalysis.
So what would be the next step?
Sure. Our next step is going to be education and planning. And we're going to talk about a lot of different things, including counseling and support groups for diabetics, pre-diabetics, medication, using the different supplies, nutrition, exercise, foot care, and dental health, which are all really important. Okay, so first we're going to be talking about counseling and support groups. So these are going to be really helpful for everyone to come together and be able to ask questions and talk about difficulties that they may have managing their blood sugar. It can be really helpful because one person may ask a question that another person didn't think of, and so they can all learn from each other, as well as just supporting each other and realizing that they're not alone in this health issue. In addition, we're going to talk about medical supplies and use of these supplies, so it's really important that we focus on not just teaching them, but also letting it be hands-on so that they can learn how to do it and ask questions. So this would include using a blood glucose meter, how to track their blood glucose, what's a good level, what's a bad level, how to control it using the different foods that they can eat, what they have available to them. It's going to be very specific because the homeless population doesn't have access to the same foods that other people may have access to. How to use insulin, including the sliding scale and a insulin pen for ease of administration. Choosing a site to inject the insulin and making sure that you clean it properly beforehand, and then disposal of that equipment.
So now we'll look at nutrition. More specifically, we would be able to work with the Bridge to come up with nutritional facts and info on the food they serve so that diabetics would know what they're eating and so that they could use that to monitor their blood glucose. We also would be able to provide a list of foods from different fast food restaurants and food pantries that are better options for those with diabetes. And we also could focus on exercise interventions, so offering times daily that we walk around the building to get an exercise, or having an instructor come in and lead an aerobics class for free, offering pedometers to those with diabetes so that they can track how much exercise they're getting, and also really working with those that have diabetes to stress the importance of exercise because it can help bring down blood glucose levels, and if they are obese or overweight, it can lead to weight loss, which also will lead to lower blood glucose levels.
Next, we're going to talk about foot care. So in general, you need to have good foot care hygiene, such as inspection and cleaning. We're also going to provide information how to care for wounds if they exist on the feet. And they also need to have proper footwear, such as clean socks and good shoes. We'll also send out referrals to podiatrists, and we'll provide TED hose for lower leg edema and also proper toenail clipping. Next, we'll talk about dental health. And so the Bridge already provides toothbrushes and toothpaste to the people there, but we want to also stress the importance of how to prevent bad oral health and to prevent septicemia, gum diseases, and then with diabetics, they will have slow healing, so we need to make sure we take care of that.
So in what ways are you going to try to get people to participate with your program?
Since we acknowledge that education alone will not solve their health problems, we think that it's important to offer some sort of incentive as motivation. These incentives will apply to their specific needs and possible repercussions from improper management of diabetes. So some of these things could include free socks, healthy foods such as fruits and vegetables, free grooming such as haircuts, and perhaps skincare. Additionally, since one of the Bridge's goals is to get people into stable housing, we felt that cookbooks could be a form of incentive for affordable foods. And additionally, exercise equipment such as light weights or pedometers.
As a part of any good program, we look for results, mainly through the participants and any data that has been received. We would like to focus more on the data received through the HC1 and blood glucose that would be provided from the recordings and the notebooks that the program would be providing to the participants. And also we think it'd be a good idea to have a survey or an interview done with each participant to help get a personal feedback from them.
So we acknowledge that diabetes comes with its own set of challenges that are difficult to overcome, but we wanted to create interventions that specifically address additional barriers that homeless people deal with when they also have diabetes or are pre-diabetic and want to remain healthy.
So what are some goals that you guys are hoping to accomplish?
Well, we created some long-term goals. So some of those are that we want to create a community that supports and encourages individuals with diabetes, because it's definitely something difficult to manage when the individual is homeless and doesn't have like a regular source of healthcare. We also wanted to focus on having sustainable interventions and access to supplies so that the individuals can manage their diabetes to the best of their abilities despite their challenges.
And then we want to achieve these long-term goals with our short-term goals, which would be to increase the awareness for diabetes and the risk factors that are associated with it. We want to determine the barriers of homeless diabetics from their perspective. And lastly, we want to improve the management of diabetes in 50% of diabetics over 3 months. So this would be done by recording H1C and daily blood glucose levels on a small notepad that we will provide.
We believe that our intervention follows the triple aim, which was created by the Institute of Healthcare Improvement. The 3 goals of the triple aim are to reduce cost, improve population health, and improve individual quality care. So we believe that this program will help reduce costs for these diabetics as they're in a homeless situation through free education, services, and health promotion. And we believe that this can improve the overall population health of homeless diabetics, which could also spread to other homeless to improve exercise and healthy eating.
Alrighty guys, thanks for coming in today. Really appreciate your guys' hard work. It seems like you guys put a lot of thought and effort into this. I really like how you guys touched on a lot of the aspects that we may have missed, especially on the more hygienic and transportation and the less luxurious forms of help. Definitely put a lot of thought into it, so we're going to try to bring this back to my team, see what we can do, see what we can implement. Definitely keep you guys updated. Thanks for coming in.
Thank you.
Thank you.